Hey.
Hello, how are you?
I'm doing good. How are you doing, Andy?
I'm doing great. It's hot.
It is very hot here. It's like over 100 degrees.
Is it normal for Texas to be like 107 all the time?
I feel like it's not normal, but it is this year, so we're just going with it. We're going on like month 2.
Well, thank God for air conditioning. But
Come on in for air conditioning.
thank you. Well, are you ready for your 73 questions?
Yeah, let's do it.
Alrighty, so let's get started. What is your name?
My name is Nicolet Finger.
And your specialty?
I'm specializing in physical medicine and rehabilitation, also called physiatry.
And what year of training are you in?
I'm in my 4th year, so in my last year.
Almost done.
Yeah. I'm
Light
super
at the end of the
excited.
tunnel. Where did you go to undergrad?
I went to the University of Texas at Austin.
And medical school?
Texas College of Osteopathic Medicine, which is now called UNT Health Science Center Medical School.
Yeah. And residency?
And I'm at residency in my last year at UT San Antonio.
All right. Now, did you take any gap years before going into medical school?
I did not, no. I went straight through, but I did graduate undergrad a semester early, so I had some time off and traveled to Italy.
Well deserved. So, what was your favorite part of medical school? I know it wasn't too long ago.
Yeah, so I think clinicals were my favorite part. Didactic years were just not for me.
And yeah, I don't exactly miss the 4+ hours of lecture.
Yeah, neither do I.
No. What specialty did you think you were going to go into on your first day of med school?
I actually thought I was going to go into OBGYN.
And what changed your mind about that?
So I didn't even change my mind until about halfway through 3rd year of medical school. And I did my OBGYN rotation and just didn't come home excited. I think it's a wonderful field, but I just didn't come home fulfilled, and I couldn't see myself doing it for the rest of my life.
That's a very common sentiment in the
Yeah.
3rd year and even extending into 4th year.
Absolutely.
So, were there any specialties out the gate you immediately said, absolutely not for me?
General surgery and like orthopedics, anything that was heavily surgically inclined. Though OBGYN, of course, is too. I think I just always valued that clinical aspect more until I did the rotation, and that's probably one of the factors of many that made me change my mind is the OR just really wasn't for me.
Joe, it's a great environment, at least for me. So, what first made you fall in love with PM&R?
That we get to help people improve their function and their quality of life. It's amazing.
All important things.
Yeah. Here, let's come this way. And it's pretty early in the morning. Do you want a cup of coffee?
I will never turn down a cup of
Okay.
coffee.
Sounds good.
The former barista in me always gets excited. So, now, I know there's a lot of people that want to pursue a career in PM&R.
Yeah.
So, how long does your training take after medical school?
So after medical school, residency is 4 years. That includes 1 intern year that is a general year in either medicine or you can do kind of a transitional year, which is a mix of everything. And then 3 years of PM&R.
Okay. Did you consider getting any other degrees like an MBA, MPH at all?
I always thought it would be cool to do, an MPH or even like a PhD, but ultimately I decided not to because I wanted to just do what was going to be more useful to what I really wanted my life to look like after residency.
Yeah. So what would you say is the most unique part of your specialty?
I think that PM&R is such a unique specialty because we get to work with teams of other allied health professionals. So we work with physical therapists, occupational therapists, speech therapists, recreational therapists, I mean, you name it. We work with so many other individuals and very, very closely. One good example is on the inpatient side, which is my favorite. We have a team conference every single week with all of these individuals, and we talk about our patients. And so it's just such a collaborative environment, and personally, I feel like that's how all medicine should be.
I agree. So this is the fun part. I always let everyone kind of sell their specialty like a car salesman. So why should someone go into PM&R? And it's a very underrated specialty in my opinion. There's a lot of good reasons to go into it.
It's very underrated. I think if you like anatomy and you like neurology, it's a great field that kind of combines these things. And if you really want to help people live their best life, so even after a cure, right, or after you've solved a problem or figured out what their disease is, there's still so much to be done. These patients who can't walk, can't talk, can't eat, and that's where we get to come in, which is really fulfilling.
Now, flip it around, play devil's advocate. Why should someone not choose your specialty?
Okay, so I think if you don't like anatomy and you don't like neurology, it's probably not the specialty for you. And apologies for the water boiling in the background,
okay.
but the coffee will be worth it. It'll be worth it. So yeah, you don't like anatomy, you don't like neurology, probably not for you. But I would urge you to wait until your clinical years, because personally, I didn't like those fields either until I saw them in a clinical setting. I loved repro and endo and, you know, pulm and cardio and all of those so much more than I liked anatomy and neurology until I got into the clinical setting, and that all flipped. So I keep an open mind.
Oh. So are there any stereotypes of your specialty? And there's already one that comes to mind.
Absolutely. I'll just get rid of the elephant in the room. The really big stereotype is that PM&R stands for plenty, money, and relaxation.
Well, is that stereotype true?
I'd say it can be, right? So I think just like any specialty, you can make it what you want once you're out of residency. That being said, with PM&R, it's probably easier to make it what you want than other specialties. I still think if you're a surgeon, you know, surgery residency is going to be really hard, but once you're out in your attending practice, you can do what you want. You can work part-time if you want. In PM&R, there's just more options. You can do clinic, you can do inpatient, and even inpatient is very flexible for you having your life outside of medicine. You see a lot of us who have tons of hobbies, and I think that just goes to show that we're a really, you know, wellness-oriented field, both for our patients and for ourselves.
Oh. All right, so another fun question. With any stage of medical training, from the third year med student to the second year resident and beyond, there's this concept of on-the-spot testing of random medical knowledge, also known as pimping, which I learned recently stands for put in my place.
Yes, I actually learned that like my fourth year of med school, that it actually stood for something at least better than it sounds.
Yeah, well, what's the craziest question you've ever been asked by an attending?
Craziest question, I'd have to say in PM&R, so let me just start off. I don't know if there's any craziest question I've been asked, but in PM&R, we get a ton of questions that there's no right answer to, because we are expected to think outside of the box and make up a solution even if there's not one. So for example, let's say one of our patients lives, which this happens all the time, lives in a trailer, right? In a trailer park. And they've got 6 wobbly stairs up to their trailer and this tiny little bathroom with a shared toilet and shower. And they've just had a stroke and they can't actually maneuver any of those things. A lot of times they'll ask, what do you want to do, right? What do you want to do about this? How do you want to help the patient? And I think that problem solving and thinking outside of the box is just really cool. But it can definitely put you on the spot.
Yeah. All right, so what does an average day look like for you?
So depends on if we're talking about inpatient or outpatient, but let's just roughly go over both. So outpatient, you're looking at a clinic just like you would any other clinic. Think cardiology, pulmonology, family medicine, right? You're talking an 8 to 5 with maybe 15 to 30 minute time slots and a break for lunch. On the inpatient side, you could think of inpatient PM&R as the day, the flow of the day goes very similar to inpatient medicine, where you start by seeing all of your patients for the day, you put in orders, you talk to other people on the team, in our case, a lot of the therapists and the nurses, case managers. Then you do admissions and discharges and kind of take care of everything else for the day, and then you're done, right? So then that just kind of starts over. So I'd say the inpatient and outpatient models a lot of other fields.
Yeah. So how many patients do you normally see in a day?
On the inpatient side, you can see anywhere from, say, 14 to 25, 30 patients, Typically, if we're up to like 25 or 30 patients, we're splitting the census, at least in residency, and so splitting that number of patients. And then in the outpatient side, you could see usually about 20, 25 patients a day.
Okay. Well, you've mentioned there is variety in both outpatient or inpatient.
Yes.
For you, one, what is it more of? And two, what do you prefer?
So I prefer inpatient. I think typically in PM&R, you're going to find more variety on the inpatient side, only because in the clinical setting, people tend to subspecialize. Even if you don't do a fellowship, you tend to kind of find your niche. You can do a spasticity clinic, a sports medicine clinic, a pain clinic. And so there's a little less variety, though there's absolutely general outpatient physiatry clinics, which do a little of everything. And then on the inpatient side, usually you have a general rehab, which sees anything from strokes, brain injuries, amputations, hip fractures, spinal cord injuries. I mean, like Parkinson's disease, I could go on and on and on. Yeah. Or I guess the exception to that on the inpatient is there are units that are just focused on stroke or spinal cord injury, but more variety on the inpatient side.
Gotcha. And I do have a question that I'll touch on, kind of that subspecialization a little bit more. So what's the most amount of patients you've ever seen in a day?
I have probably seen, let's see, on an inpatient service where we also saw some consults, I've seen about 23 patients a day. And on the clinic portion in a sports medicine clinic, I have seen 55 patients in a day. So 55 is probably the max. Those are quick visits, not my preference. I would much rather spend more time with my patients.
That's a lot. Oh, what procedures do you do, and what are the most common ones?
So in PM&R, you can do a ton of procedures. Most commonly, if you don't do a fellowship, you're going to be doing things like joint injections, so like knees and shoulders. You'll do and maybe carpal tunnel injections. You can do trigger point injections, which are injections into the muscle with lidocaine and steroid to kind of get a benefit of both dry needling and provide some anesthetic and decrease inflammation. We also do, which is kind of a procedure, we consider it a procedure, EMGs and nerve conduction studies. EMG stands for electromyography, and it's a very complicated test, but in short, you're testing the muscles and the nerves and how they communicate to see if there's a problem either coming from the neck, the back, or a peripheral nerve.
Gotcha. What's the most common diagnosis or problems you see patients for?
I honestly think that there's not one most common, but if I had to pick some of the big categories, it would be brain injury, stroke, spinal cord injury, and then MSK, like musculoskeletal, so amputations and hip fractures, things like that.
Gotcha. All right, so this is a fun question that I'm surprised I haven't asked other guests, but it was suggested by an Instagram user. Any emerging technology or advancements that you find exciting or promising within your field?
That is a really good question. So in PM&R, there's really a lot that I could probably touch on, but one of the coolest things I've heard about recently is something, so we use something called a spinal cord stimulator already for people with chronic pain, but there has been trials of using something similar to help people with spinal cord injuries walk again. And this is very, very early, so it's not something that's available to the general public or anything like that, but it's something that's being researched and I think is really, really cool.
Who wouldn't want to help people walk again?
Exactly,
So,
yeah.
what is one thing people misunderstand about the field of PM&R?
I think a lot of people just don't know what we do, to be completely honest. We'll get a lot of consults that are like, hey, this patient's discharging, can you help us get the patient home? Which is somewhat what we do if you're talking about a patient with functional deficits who needs help living on their own, but is not what we do if you just need someone to write the discharge summary.
Yeah. Welcome to the hospital office politics.
Exactly.
Oh, what is the toughest part of your job?
Let me give this to you here.
Thank you. What is the toughest part of your job in your opinion?
I think telling people what to expect. So prognosis. When you have, especially like a young person who has a debilitating injury or disease, so picture, a young 25-year-old who's in their prime, working towards all their goals, and they get in a car accident, and they have a spinal cord injury, and now they can't walk. And they're asking you every single day, am I gonna walk again? And depending on the injury, it might be yes. And usually if we're seeing them, the answer is probably no, or that it's gonna take a while. And their life is gonna look a lot different after that injury. And so that's absolutely the hardest part, is having those conversations.
On a more positive note, what's the most rewarding part of your job?
The most rewarding is when you get to exceed people's expectations. So kind of like the last question, when we give expectations to patients, we want to give them hope, but we don't want to give them false hope. So we talk about all the things that could happen, but we also talk about the reality of the situation. But it's so cool when you really get to do more for them than you thought you would. We all hope that, right? You always hope that you'll be the doctor that they say, you told me I wouldn't be able to do this and I could, and I will gladly be that doctor. I will gladly say, you're right. You succeeded. You did so much more than I thought you could. And I just love those moments.
Awesome. So kind of more lifestyle questions too. How many hours do you work in an average week?
Yeah, so depending on what you do, it can change. Your first year of residency is your intern year, and you basically belong to whatever specialty you're in. So if you're working for internal medicine, you work their hours. If you're on your ICU rotation, you work their hours. So intern year, it's about 70 to 80 hours a week. Once you're out of your intern year, we typically work 40 to 50 hours a week as PM&R, advanced PM&R residents.
Yeah. What time do you normally wake up?
6:45. That's when my alarm is always set.
I understand.
Maybe it's more closer to 7
I understand.
when I'm out of bed.
What time do you normally leave the hospital?
To get to work or to get home?
To get home.
To get home, I'm usually leaving about 4 to 5, depending on the rotation.
Okay. How many hours of sleep are you typically working on?
I get 8 hours of sleep, and I honestly can't live without it. But yeah, highly recommend getting your sleep.
How many hours of sleep are you working on right now?
Right now, last night, I think I got like 7.5. So yeah.
Close.
So close.
So, do you have to take call?
Yes. So your intern year, you'll take call with whatever specialty you're in, but so that can vary. In my program, during our second year, we take call on Saturdays and Sundays, and then on nights. But those are, so you could either do a night rotation where you're just working Monday through Friday nights, or you could be on call for a full Saturday for 24 hours or a full Sunday for 24 hours. And we kind of rotate through that. Your third year, you still do those shifts of nights, those Monday through Friday night shifts. Those are each 12 hours, by the way. But you kind of drop the Sunday or Saturday and Sunday call shifts, and we only do Friday calls, which are about 12 hours as well, maybe a little more than 12 hours.
Okay. And circling back to some of the subspecialization that you were mentioning earlier, what are the opportunities for further subspecializing?
So you can do, there's actually a lot in PM&R, and I probably will forget like half of them, so nobody get mad at me if I skip some. But brain injury is one, spinal cord injury. You can do sports and spine or just sports medicine. You can do pain medicine, occupational medicine. I'm sure I'm like forgetting something because we're here talking about it, but there's a lot and a ton of really cool subspecialties.
Yeah. So how long does it take you to chart at the end of your day?
I actually usually chart throughout the day. So typically I have maybe 2 or 3 notes when I hit about 4 o'clock that I have to finish up. But usually on an outpatient side, I try to prep all my notes before clinic. And then during clinic or during the visit, I try to fill things in as I can so that at the end of clinic, I'm just kind of signing and putting in a few last orders.
It's very efficient.
Yeah.
So, who are you most thankful for on your care team?
Honestly, I don't know if I could pick one person. The care team is full of just so many wonderful individuals. And like, I even realized as we're talking that I missed so many people, right? So we have PT, OT, speech, case management, we have the nurses, we have respiratory therapy, recreational therapy, and we have our certified prosthetic and orthotic, individuals who are just incredible at their job. And even saying all of that, oh, and our psychologist, right? Like, I mean, every time I think about this question, I'm like adding one more person to the list because it's just such a wonderful collaborative specialty.
What's the most common medical advice you give to your patients?
That's a good one. Honestly, it's a lot of healthy eating and exercise for whatever they can do. So I deal with a lot of patients with disabilities or, disorders that limit them. And so we always try to find, especially nutrition is something that we can always work on, right? No matter your disability, that's usually something that we can work on. And then exercise is for everybody, right? Even people with a spinal cord injury, even people with a brain injury, there are ways that you can exercise and stay healthy. And so those are always two things I talk about.
Alrighty. And kind of a reflective question too, before the reflective questions at the end. What's been your most impactful patient encounter?
Oh my goodness, I have one like off the top of my head. So a little backstory is there are different parts of your brain that deal with speaking and with singing. And so sometimes if people have a stroke and they have trouble speaking, which is called aphasia, then they can sometimes still sing. Now, that's not all of the time, depends on where the stroke is, the type of stroke, the severity. But I had a patient who was a 28-year-old male. He loved to work out and he was a family man. I mean, he had the whole world ahead of him and he had a stroke. There was no reason. They called it cryptogenic, meaning they really had no idea why he had a stroke. And so I went up to see him in the hospital to bring him down to our rehab center. And he was obviously very, very upset and sad. And he was trying to speak, but it was just a bunch of jumbled words. And so I kind of just thought, hey, I have got a few extra minutes. Let's just do this now. And I told him, let's sing Happy Birthday. And of course he smirks at me and kind of rolls his eyes. But I start singing Happy Birthday, and let me tell you, it was a bit awkward at first because there's like 3 family members in this patient, and I'm singing Happy Birthday alone, and he's not joining in. But I just keep going, and about the 3rd round of Happy Birthday, and yes, I know I sang for 3 rounds by myself. Don't ask how I was that motivated to get this guy to sing. He starts chiming in and singing, and the words are clear. And as he's singing, he starts crying and his family starts crying. And it was just such a wonderful moment because he thought he lost his voice. And of course, I just chose some cheesy song like Happy Birthday because I knew he would know it. I didn't know what songs he listens to outside of that. But then music therapy became a really big part of his inpatient stay with us. And so it was very rewarding.
I didn't even know music therapy existed, period.
Music therapy is such a cool thing. And sometimes even if you have therapists who they're not really trained in it, they're still willing to give it a try. So it's really cool.
Okay.
Yeah.
Wow. On that note, we've talked a lot about your life inside the hospital and the workplace. How about your life when you clock out? So what is your favorite thing to do when you're not working?
So I love to do yoga and I love anything outdoors, hiking, camping, you name it.
Okay. Do you have a significant other?
I do, yes. I'm married. We are about to celebrate our 2-year anniversary.
And any kids of your own?
I am pregnant. So this is decaf coffee. Sorry, I didn't tell you. But I'm about almost 14 weeks now.
Oh, congratulations.
Yeah.
Oh, does your family ever ask you for random medical advice?
All of the time. And you know what's even worse? Is that sometimes, so my husband is a hospitalist, sometimes my dad will call him for a problem that is like his knees hurt or something that is totally my field, and I have to tell him, wait, you can't call the internist, you should be calling me. Yeah.
It's like you have a specialist right here in your backyard.
Yeah, I'm like, look.
What's the weirdest question a family or friend has ever asked you?
It's usually rashes. I can't honestly think of like one question, but it's usually rashes, and I am just not, dermatology is just not my thing. But luckily I have dermatology friends, so usually those get forwarded along.
It's always the derm stuff.
It's always the rashes. Here, let's come sit down.
Here. Any pets?
I do. I have a cat, and he's probably under this couch right now. Will probably not show up because he is a scaredy cat.
Oh. Hopefully he comes out and makes a little guest appearance. So, favorite animal, not a dog or cat?
Not a dog or cat. I think a lion.
Good one.
It's kind of a cat, but not really. I think they're different. We're going to say it's different.
I've heard a lot of people choose lion. So, if you could have dinner with anyone in history, who would it be?
Anyone in history? Honestly, I have no idea. I would probably choose someone. Can I choose someone living?
Yeah.
I think I would choose, this is going to be very cliche. I'm sorry. But I think I would choose Taylor Swift because I would ask her how she was able to get so high up in her fame while still being true to herself, which is something I value when very successful people are still true to themselves. So I don't know anything about history, so we've got the history thing is not my forte.
Respectable choice. I am a Mayer fan, but I've also had Speak Now Taylor's version on repeat, so I don't know how to feel.
Yeah. My husband's gonna make fun of me because he's gonna be like, "You couldn't think of anyone in history," and I'm gonna be like, "No, I couldn't."
No.
I couldn't.
What would you guys be eating at that dinner?
At that dinner, Thai food. It would definitely be Thai food. That's my favorite takeout.
Oh, great choice. What's your favorite dish to eat?
So let's say we're not saying Thai food. Pizza is going to be my next option.
Also a solid choice.
Yeah.
Any favorite restaurants around here?
So there's a lot of like really cool fancy restaurants. I'm more of a low-key type of person. But in the Pearl, it's kind of the Riverwalk, but it's down on the Riverwalk, a little less crowded. There is a place in the food hall called Mi Roti, and it's really, really good if you like spicy food.
Coffee, tea, or soda?
Coffee, for sure.
How much water should you be drinking every day?
So I drink a ton of water, but a lot of people say like 10 ounces for every, whatever is it, pound? I don't know. 10 ounces for every pound or something. I'm not sure. I would just say drink like 2 gallons of water a day.
That's a lot.
I drink a lot of water.
Favorite meal from the hospital cafeteria, if you have one?
So I don't eat at the hospital unless the attendings take me into the attending lounge, in which case they have really good chicken tacos.
Ooh, that sounds great.
Yeah.
Top 3 music albums.
So I will say that I'm more of like a per song person, but I love Taylor Swift, obviously, and I love her new album. So like the Taylor version, all of her Taylor versions are great. So I think the most recent one that I have liked is the Speak Now Taylor version. I love Dan and Shay, and they came out with like, actually I think they're just releasing one at a time, but the bigger houses. So I love that. And Buy Dirt by, who is it? Jordan Davis? Watch me be wrong, I'm the singer. But that song is everything. So that whole album, I'm about that.
Okay. Favorite song at the moment?
I would have to say Bigger Houses. That one just came out. It's by Dan and Shay. And so I love that.
Great artist. Mm-hmm. All right. Pineapple on pizza, yes or no?
Honestly, yeah. If I'm craving it, I actually grew up eating pineapple on pizza. So I'm totally for it.
I'm not judging behind the camera. Any artistic hobbies you keep up with?
So I do love to paint. Actually, when I spent 5 months in Italy before medical school, I really learned to paint a lot better than I was before. Of course, I think like I'm still very limited. I can only really paint with acrylics. I know nothing about painting with oil, but it's really fun.
Okay. Favorite movie or TV show?
I would say my favorite movie is Frozen. Do not make fun of me. We're just going to leave it there.
Okay. One random task you wish you could be better at?
Remembering people's names. I'm
that's a
horrible at
really-
remembering people's names.
That's a really good answer.
Yeah.
'Cause that's something I try to be really intentional about working on. That's a
Yeah, I have to
great
just like repeat it so many times in my head, make a memory hook. It's a lot of work for me.
Yeah. What's your favorite way to relax after a long day?
I just honestly love laying on the couch and just totally zoning out. If you want like an answer that's more productive, I do love going to yoga, but yeah, like immediately when I get home from work, I'm just like on the couch.
Couch potato.
Yes.
Nothing wrong with that. So, night in or go out on the town kind of person?
Night in, absolutely.
Indoors or outdoors?
Outdoors.
Beach or mountains?
Beach.
Would you consider yourself more of an introvert or an extrovert?
I think I'm more of an introvert. A lot of my friends would argue, but I recharge alone.
Was that personality trait a factor in you choosing your specialty?
I think that I'm just an outgoing person when I am well rested and recharged, and so that probably made me very good for PM&R. But then I require a lot of time just like by myself at home to feel able to do that.
Yeah. All right, well, we're getting close to the end, and of course this is where I bring up the reflective questions. Are you ready?
I'm ready, I think.
All right, so what did you think you were going to be when you grew up as a kid?
So as a kid, I really actually did want to be a doctor. I just had no idea why. I just thought it was like fun to have a stethoscope. So I can't say I knew why I wanted to be a doctor, but that's what I always had in my head.
You have the Fisher-Price, like plastic
Yeah.
stethoscope and everything.
Exactly.
Oh, yeah.
And now I don't even wear a white coat, so only in pictures.
Only in pictures. Is there a different specialty you think you could have done?
I think if I didn't find PM&R, I was leaning towards family medicine only because it's so broad that I would have just made it what I wanted. I would have just kind of formulated my own little career within that.
All right. So if you didn't do medicine, what do you think you'd be doing right now?
I think I probably have two answers. Practical answer is that I would have been a nutritionist. So my degree in undergrad at UT was nutritional science. And I love that. Like I counsel a lot of my patients on nutrition. Not practical. I would have just like lived in a van or like a tiny home and had my own little farmstead.
Yeah. Nothing wrong with that either. So, all right. Everyone knows that the path to being a doctor is not easy at all. Were there any times that you doubted you would even make it as a doctor?
Absolutely. So my first test in medical school was like cell biology, and I had just gotten back from Italy. I hadn't studied in probably 6 months, and I failed that first test. And that just totally rocked my world because as most of us who go into medical school, we usually do pretty well on tests. And so that really just changed my perspective. I don't know if I thought, oh, I can't do it, but I definitely thought this is going to be harder than I maybe anticipated. And a lot of other people doubted me too. I went to a learning specialist at our school who just kind of assumed I was going to fail the class and told me, oh, when you fail the class, you can remediate it over Christmas. And I looked at her and I was like, I'm not failing this class. I may have failed this first test, but I'm not failing this class. And I told her, thank you. And I walked out and I passed the class. So I think just keep moving forward.
Good for you. So, if you could change one thing about the medical field right now, what would it be?
I would change that insurance runs so many of our decisions. It's very frustrating when you can't get your patient what you want for them because insurance says no. And it just makes you think, who's the doctor here? Like I am saying my patient needs this. And so why can this third party decline it? That gets frustrating.
It's a very common theme across all my interviews.
Yeah.
So, what can a medical student do right now to prepare to go into PM&R?
So the best thing to go into PM&R is to get experience in the field, whether that's clinical or non-clinical. So do a PM&R rotation or shadow a PM&R physician. I suggest starting with a general physiatrist so you can kind of see a little of everything. And then volunteer work. You can volunteer for the disability community in a lot of different ways. There's adaptive sports like wheelchair rugby. There's always the Special Olympics. And there are DME, which stands for Durable Medical Equipment, repurposing organizations that take things like wheelchairs or walkers, clean them up, fix them up, and then give them to people who can't afford them. So those are all really, really great ways to get involved.
Gotcha. If you were to go back, would you change any of your experiences that got you to where you are right now?
So I don't know if I would necessarily change anything just because I met my husband in medical school. Like there's so many wonderful things that happened because of my journey. But I would definitely have started using Anki earlier. I was so hesitant. I pushed off Anki until probably like halfway through my second year. And if I had just bit the bullet and done it, I would have like done so much better, I think, in the didactic years.
You guys can't see me behind the camera, but I am like smashing my hand in my face because that is a brutally true statement.
Because you first look at Anki and you're like, this looks archaic. I can't do this. It sucks. So then I closed it and I didn't open it until like halfway through second year. And once you get the hang of it, it's like, why did I not do this before? I don't know why I didn't do that before.
No. I swear if I used Anki the way that I used it in my third year, I probably would have graduated top of my class.
Yeah, same.
I ain't gonna lie.
Same.
So, all right, we're putting a lid on that can of worms.
Put that behind us.
Okay, well, question 73.
All right. Wow, we made it.
Made it.
I'm not even sweating. Maybe a little bit.
You are fine. We're in air conditioning, remember?
Yeah.
So, what would you say to the aspiring PM&R physician right now?
I would say ask yourself, what else can I do? Because I get a lot of questions. You know, people will message me or text me and they'll say, do I need research? Do I need to volunteer? Do I need to do these things, you know, to get to where you're at? And my answer is always like, I mean, no, right? There's people who don't volunteer, don't do research or whatever, and they get to where they want to be. But be the person that asks, what else can I do? Instead of, do I need to do this?
Very, very good advice.
Yeah.
Oh, that's all I have for you, Nicolet. Thank you so much for having me out here in Texas and in the air conditioning and, of course, shining a light to a very, very underrated specialty that I think a lot of students should consider more, and it's only going to grow.
I think so, too. Thank you so much for coming.
Oh, thank you.